And don't get me started on.
Don't get you going. Okay, well let's get started.
All right, yes. So, let me just pull up my worksheet here. Okay, so let's do this. Hello, everyone. I'm Mallory Johnson, 26-year beauty veteran, fractional COS and strategist. Welcome back to Pretty Equity, where we tackle the real issues facing beauty founders and investors and bring you the answers from the experts behind the deals. Earlier this month, the EU Safety Gate flagged a baby wet wipe product for contamination. Mesophilic aerobic bacteria, molds, Candida albicans, multiple batches, full market withdrawal. And to make matters worse, the product was applied to infants, the most vulnerable consumer category there is. The product was clean positioned, short INCI list, marketed on a 99% water platform. And here's the part that got me. The formulation had a preservative system, three preservatives, in fact, a pH adjuster, and multiple mechanisms of action. So on paper, this was a thoughtful formulation, but it still failed. And this is not an isolated event. It is the predictable outcome of a market dynamic that was decoupled, that has decoupled formulation from formulation science. The consumer-facing clean environment in its form today, so in its current form, has done real damage to preservatives as a discipline and to chemicals in general. The parabens reformulation wave was the first big example, which we'll get to in a little bit. But this wet wipe case is the downstream result. So today's conversation is about what preservation actually is, what the clean movement has cost us, and we will make a distinction in a bit about what we mean by that, and the single highest leverage decision a founder can make in formulation. And that is, as I say over and over again, choosing the right chemist. My guest today is someone who needs no introduction, and I'm thrilled to have back with us again, Mark Broussard. As you guys know, Mark is a cosmetic chemist who's been on the show twice before, and every conversation we have had together just keeps getting sharper. As you guys also know, Mark is a clean chemist, and what he means by that is something quite specific and something he will define for us up front, because the rest of the conversation depends on exactly that. So, without further ado, Mark, welcome back to Pretty Equity.
Hello, Mallory. Nice to see you again. Pleasure.
Absolutely, all mine, trust me. So, Mark, before we carry on, I want to anchor terms, right? So, the description that you give yourself, you describe yourself as a clean chemist, right? But the
Yes.
word clean today has become a little loaded, particularly in the beauty industry, and it means very different things to very different people. And frankly, a lot of what gets sold under the clean banner today is not something that you or I would even call safe or healthy, right? Which is what,
Mhm.
people have come to understand the term clean to mean. So explain to us, what do you mean when you call yourself a clean chemist, and how is your definition different from how consumers understand the clean, how this clean movement has come to
Mhm.
understand the term clean?
Yes. Yeah, I have been formulating clean since well before there ever was a term clean. So several years before that. And the way I came about that is primarily from the perspective of sustainability and biodegradability. In terms of looking at ingredients, that was my main concern. Now, when you get to toxicity, you know, all of the ingredients that are used in cosmetic products have well-defined toxicity profiles. Those toxicity profiles change over time, and a good example is retinol, which has been used for decades, and then the EU is now looking at regulations to reduce the amount of retinol allowed in a product. So uh, just because something has been used doesn't mean that it's always safe or the use levels are always appropriate. So that's always a consideration, but you keep on top of that. So when I started formulating, my whole philosophy was the closer to the coconut, the better. Meaning nature provides solutions to problems. And as you get closer to the nature provided ingredient or substance, the better for your skin. That's what nature intended. So that's how I define clean, is primarily sustainable, biodegradable, non-toxic or an acceptable toxicity profile, but the emphasis is on the biodegradability and sustainability.
Okay. All right. So, just for the audience, guys, I need to be clear. This conversation is about preservatives and preservative systems, particularly. Okay, we need preservatives, right? We need them in cosmetics. We need them in personal care. We need them in anything that has water in it,
Yes.
right? Anything that gets touched by human fingers, anything that sits on a shelf in a bathroom, in a diaper bag. Preservatives are not there because the law requires them. They're not there just because your shelf life, marketing convenience, check the box, whatever. They're there because without them, products grow bacteria. They grow mold, they grow yeast, whatever, they grow microbes. And those microbes in those products then go on human skin, including the skin of infants, the immunocompromised, and the elderly. But the new clean environment, what I love to call the chemphobia movement, because at this point, to me, that's all they are. That's all it is. It's just a fear of chemicals, and particularly those with names that people can't pronounce. And they are the ones who've decided that not only are chemicals the enemy, but right now it seems that preservatives are the enemy. And I'm hearing things like founders coming to me with a straight face and telling me that they are now formulating completely preservative-free formulas, right? They say to me things like, well, there's no water in it, so we don't need preservatives. Or we're going to manufacture in a sterile facility. Okay, well, good luck with that. But yeah, okay, so they don't need preservatives. Or they're now going with the single-use packaging, so they don't need preservatives. Um, I want to call this what it is. None of those workarounds are what they sound like. Anhydrous formulas can still grow microbes once water is introduced by the
Mhm.
consumer's fingers. I don't know, humidity in the bathroom air, a drop of water that might, I don't know, drip off the bathroom mirror. Water can come from anywhere, right? Sterile manufacturing protects the product from contamination at the factory. It does nothing once the packaging is opened. Single-use packaging, also wishful thinking, applied to a product that by definition is now going to be opened and touched by the consumer. So, we need preservatives. And the wet wipe case, the one that I'm about to put in front of you today, the one that triggered this episode of my conversation with Mark, is the predictable consequence of an industry and a consumer market that has lost the plot on what preservatives are actually for. So, Mark, before I get into that case, from your seat as a chemist, walk us through plainly why we need preservatives. I know I gave my spiel, but what
Mhm.
happens to a cosmetic product without an effective preservative system? And when a founder comes to you saying that they've engineered a preservative-free formula, anhydrous, sterile manufacturing, single use, whatever, right? What's the truthful chemist's answer?
hmm Yeah, preservatives are essential in a cosmetic product because, as you said, if you have water or water is introduced, that is a source for the growth of bacteria, yeast, and mold. From a brand perspective, your products or need to be safe for consumer use. From a brand reputation perspective, your products need to be safe for consumer use. So if your product is not properly preserved, it is going to grow yeast, mold, and bacteria. It will smell rancid. You may have some separation. You may have some color change. Depending upon the product format, you may actually see the mold growing on the surface of the product. So regardless of legal requirements, just from the pure perspective of brand reputation, you really do not want to put products out there that are under-preserved or not preserved. And you'll lose your consumers, and two, the FDA now has a recall capability, so they can force you to pull your product from the shelves. That severely damages your brand reputation and is very, very expensive. But primarily, it's to protect consumer health. That's the whole reason you preserve products.
Mm, mm. Okay. So with that framework on the table, right, and the foundational questions settled, okay, we understand what preservatives are and why we need them. Okay, I want to talk about this baby wipe case.
Sure.
So earlier this month, EU Safety Gate notification, one sec, SR 012926. These wet wipes were recalled from the EU market, even though the product was clean positioned, like I said earlier, 99% water, short INCI list, preservatives on the label. It had in fact three antimicrobials: sodium benzoate, potassium sorbate, and ethyl lauryl argonate. And I'm not a
Yeah.
chemist, so please forgive
Yeah.
me.
No.
It also had a pH adjuster, citric acid, glycerin, and a watermelon extract for humectancy. The substrate, okay, the substance that the
The
wipe was
wipe
sitting
itself.
on was 100% pure cotton.
Mhm.
Here's the thing. Multiple batches were contaminated with aerobic bacteria, mold, and Candida albicans. And this product was being applied to newborns. So there was a full market withdrawal. Mark, this is the kind of failure. If you were to just read the marketing, this should never
Mhm.
have happened.
Yeah.
The product had preservatives in it. Like I said, three. It had the pH adjuster. It was, in short, a modern, consumer appealing, clean positioned INCI list. Yet it failed badly enough that it was recalled completely from the EU market and on a product applied to newborns. So, from your perspective, as a chemist, what actually happened here?
There were a couple of possibilities. First, the cotton substrate could have been contaminated and probably was. Second, the cotton substrate can absorb the preservatives from the solution, from the wipe solution, making the preservative less available to preserve the product. And three, the product may well have been under preserved. So if you take a look at the INCI list, all of the components for a good preservation are there. However, when you have a substrate that will basically neutralize or absorb the preservatives and can contribute to the microbial environment, this kind of situation will happen. Since the product was targeted at newborns, they probably tried to use the preservatives at the lowest level they possibly could. Um, and that's probably a component of what happened to the failure here. So what they could or should have done was used irradiated cotton wipe substrate that would have gotten rid of the bacterial contamination from the substrate itself and probably used the preservatives at a higher level than what was included. So I think it was a combination of all of those factors that contributed to the failure and the recall.
Okay. All right. Okay. So for this foundational case, right, we have the framework for the preservative itself, right?
Mhm.
The li this you know,
The arginate and the acids, yes.
yeah, yeah. And but what's still coming back to me and what I want to make sure that the audience understands is there's a big difference between having preservatives in an INCI, on an INCI list, and
Hmm.
having preservatives in your formula and actually having, the formula be preserved, right? Do you
Yes.
understand what I'm
Yeah.
saying?
Yeah. Yeah.
You can have preservatives on paper, but that doesn't mean that your formula is actually preserved.
Correct.
So I want to spend the next segment talking a little bit about what that preservation discipline actually is. So, let's talk about um, preservation as a system. Because,
Hmm.
like I said, it's not just names on an INCI list. Mark, how do you design? What does a well-designed formulation with a well-designed preservative system actually look like?
Hmm. Yeah, as you point out, preservation is actually a system. So it's not just putting preservatives into a product. First of all, the preservatives need to be at the proper level to be effective. So if you look at preservation, you're going to use glycols to reduce the water activity. The more you reduce the water activity, the less likely microbes will grow. So pentylene glycol, glycerin, etc., and even sugars like sorbitol or trehalose will bind up the free water, so less free water is available for the microbes to use as a source. So you start off with the preservatives themselves included at the proper levels, um, glycols or preservative boosters to reduce the water activity, chelating agents such as gluconolactone or EDTA to bind up heavy metals. Again, those are used as nutrient sources by the microorganisms. pH is very important. The lower the pH, the better. The more difficult it is for microbes to um, survive and replicate in that environment. And a lot of people don't think about this, but packaging. Packaging is a component of your preservation system. If you have an open jar that clients can dip their fingers into, they're introducing a new microbial load every time they use the product. Um, Contrast that to an airless pump system where the client's hands never actually get into the body of the product, then you enhance your preservation. That may allow you to use preservatives at lower amounts.
But
Uh,
Mark, can I ask you a quick question before
yep,
you,
yep.
just to be clear, like I think I'd mentioned earlier, I hear people say we don't need preservatives, we have an airless pump. But that doesn't mean once that product leaves the container is now on your hands, right?
Mhm.
This is the reason why. So I just want to be clear. You know what I'm
Yeah,
saying? That there
yeah,
are ways to contain, what I mean, the packaging, but
yes.
that doesn't
That
mean.
that
Carry
in
on.
an that in and of itself does not prevent contamination. You have to have all of these components in place. So you can preserve products that are in open jars. You still need to, you're going to use preservative. You go to an airless pump, you still need preservatives. That just lessens the possibility of microbial contamination because the client is not putting their hands in the product. Um, there are other elements of this. If you're familiar with the COSAS case, which was an eye product with a wand, right? Well, in that case, where you have a reusable that is used to apply the product, but then is applied back into the container with each and every use, you're introducing new microbial load. For products like that, you have to do what is called in-use preservation testing. So you preserve the product, give it to a panel of people, have them use it for 30 days, collect them all, and then do your preservation challenge test again, right? To make
Mm-hmm.
sure.
And we're going to talk about testing in a bit. Hmm.
Yeah, yes, yes. So no, packaging in and of itself does not save you.
Mm-hmm.
It's just one element of a properly developed preservation system.
Mm-hmm. And again, to your point about reusables, the case that prompted our conversation happens to be baby wipes, but there are lots of other cosmetics that also have, sit on a substrate, right? It's
Yeah,
not just the packaging that they're coming in.
correct.
And again, it's something worth talking about, to say that, we used 100% pure cotton, that's what we want, you know what I
Yeah,
mean? That's the direction we want to go in, but that also means we have to adjust our preservative system.
yes.
Looking at what the physical environment is that a product is sitting in, sitting on, how do you adjust the preservative system if you have, say, 100% pure cotton?
Yeah, if you have, as I mentioned earlier, if you have 100% pure cotton, you're going to either need to irradiate that cotton before you impregnate it with the solution, or you're going to need a more robust preservation system. So, since this particular product was geared towards infants, that's, as I said earlier, I think they probably used the preservatives at the lower end of the range to get adequate preservation. So essentially, it was underpreserved. So when you're looking at a product like that, you need to think through more carefully the proper level of preservation and what preservatives you're going to need, and think through contributions to microbial contamination from your substrate. Another good example are like clay masks. Those are notoriously difficult to preserve because the layers of clay have interstitial spaces where the microbes can hide from the preservative. So in those particular cases, you normally use a mix of preservatives that attack yeast or mold or bacteria. There's no one preservative that is going to protect you against everything. Some will be better against bacteria, some will be better against yeast and mold. So you need to combine, it's that preservation, that preservative combination that really strengthens your
And
preservation system.
I am so glad you brought that up because what I want to talk to you about, or ask you a question about, is hurdle technology,
Yep.
right? Which is kind of, that was a segue into this. So,
Yes.
just for those who don't know what it is, in preservation design, you don't rely on, like Mark was saying, just one preservative to do all the work, right? You have to stack multiple antimicrobial mechanisms so that an organism that can get past one defense is stopped by the next, right?
Yes.
And it's the opposite of what I think is called the silver bullet approach.
Yeah. Yeah. Yeah.
But so Mark, walk us through that. What is, I think just carrying on from what you were saying, let's take that preservative system and walk us through what hurdle technology actually is.
Yeah, yeah. Hurdle technology is quite descriptive. So what you're doing is creating the preservation system so that the bacteria, yeast, or mold need to jump through different hurdles, and the hurdles get higher and higher and higher. So your basis of a hurdle technology, let's say we'll start with glycols to bind up the water activity. The next hurdle will be chelating agents to bind up any metals that could be a nutrient source for the microorganisms. Your next hurdle would be a preservative that is particularly effective against yeast and mold. Your next hurdle would be combining that with a preservative that has particular activity against bacteria. And then combine that with the type of packaging or the substrate that you're using to prevent microbes from getting into the product.
Mm,
So,
mm.
so that's how you would build a hurdle system.
Okay, so then that then that makes perfect sense why you're having this baby wipe failure. Because if you look at it, one of the marketing, one of them, their selling points is that they have a really, really short INCI list. So
Yes.
that just seems like it's going to be in complete opposition to, you know, hurdle
Yeah.
technology.
Yeah, an indicator there is that they marketed this also as 99% water, which means between the glycerin and the preservatives, those all combined were 1% or so, right?
Mm, mm.
And you're just not going to really reduce very much water activity with 0.5% glycerin.
No.
The preservatives they used, typically like the sodium benzoate, 0.3% is typical. Potassium sorbate, 0.2% is typical. Then those are often used in combination. The alginate, if I believe it was the alginate, um, that's probably more used in the 1% range. So just between that, if the marketing is correct, 99% water, you just simply don't have enough room in there for proper preservation.
Mm, mm. And I would also imagine, being that this was a baby wipe intended for infants and newborns,
Yeah.
the pH would have become problematic here too.
Yeah, you don't know what the pH was, but I suspect since it was for newborns, they were probably trying to formulate around pH 5.1. Now, another, an element of pH in preservation is uh, the acids, for instance. So they were using sodium benzoate, potassium sorbate. The lower the pH in those products, the more free acid you have to act as the preservative.
Mm,
So they were probably trying to formulate, I'd suspect, around pH 5.1 to be, kind of skin compatible pH because it was newborns, and they just didn't have enough preservative and a low enough pH to have enough free acid in there to really be effectively preserved.
that makes sense. Look, I think all around it was just a hot mess.
Yeah,
You know what I mean? They were trying to be too many things, all at the same time, and none of it seemed to be working. But we'll carry on talking about that in a bit. Okay, so you mentioned a little earlier, testing, and I said I wanted to come back to this. So
yeah,
let's talk specifically about challenge testing. And for those new in the audience who are new to all of this, challenge testing is basically the lab procedure, and Mark, correct me if I'm wrong, it's the lab procedure where you take a finished formulation and deliberately inoculate it with a panel of microorganisms,
yeah.
bacteria, yeast, mold, and then monitor it over time to see whether the preservative system contains any of them, so whether it's holding up. So the international standard is ISO 11930. There are two stringency levels. And the first is criterion A and the other is B. But criterion A is more stringent and is recommended for products on infants and other vulnerable populations. So, Mark,
Mhm.
let's just talk a little bit about ISO 11930 and criterion A in particular. And what does this mean for products on infants? And what does the gap look like between brands that test rigorously and brands that just use it as a check the box?
hmm Well, you don't want to put a product out to market without going through the preservation challenge testing. That's a critical component of ensuring the safety of your product for human use. You should always target a criterion A result whenever you're testing your product for preservation. Criterion B is a bit more relaxed in terms of the effectiveness of the preservation. And, there will be considerations there, for instance, with the packaging. Is it an airless pump? So there's less uh, stringency because there's less probability of contamination of the product in use. So that's what I always shoot for, is to pass a criterion A. And you're right, they inoculate the product with known panel of bacteria, yeast, and mold. Let it sit for a week, neutralize, test for colony forming units to see how much of that inoculum survives the preservation, and that's done 4 times over a 1 month period. And then at the end, you look at the log reduction in the bacterial count, and that gives you your pass fail on the criteria A or criteria B. So it's just critical. You have to do it.
Mm-hmm. So, and again, I'm coming back to these baby wipes. Because as you described it, it's like how did this possibly pass?
Mhm.
I'm not sure I'm even understanding. Look, that might be a conversation about labs and lab testing. But it does prompt that question, I mean, how far did they go with this testing?
Yeah, the testing is standardized. As long as your lab is complying with the ISO requirements, the testing itself is independent of the lab. Basically, any lab that can do the testing will do it according to
Mm,
the ISO protocols. So you should be very confident in the results that you get. In this particular case, wet wipes, the way you normally test them is you will unseal the package that contains the wet wipes, inoculate, reseal it, and then go through the rest of the protocol. So uh, I'm sure their substrate varied batch by batch in terms of its microbial content. So I suspect that was a major contributor to why this failed. Is, you know, the they got batches of substrate that were contaminated with bacteria, yeast, and mold or mold, and there just wasn't a strong enough preservation system to keep all of the bacteria in check.
okay. Okay, so before I move on to my next question, I just want to, kind of sort of draw a line in the sand here for our audience, because I feel like if I don't do this now, we're gonna risk sounding like all free from decisions are equal, because I want to move on to the difference between clean and free from.
Hmm.
Because not all free from decisions are equal. Okay, just to be
Yeah,
clear. So what I'm saying is that some of the free froms came out of evidence-based safety concerns. Things like formaldehyde, certain phthalates, mercury in skin lighteners. I don't know. There's hydroquinone restrictions
yeah,
now. All of that kind of stuff, right? And
yeah,
and those came out of toxicology, not marketing, right? So the science was sound. Alternatives exist, and the right thing to do was free from. But there's other ingredients that have been removed not because of the science, but because of fear mongering. And a canonical example for me is parabens. And I like to tell the story because
Mhm.
I'm not bringing parabens back. Don't get me wrong. They're never coming back, right? What's done is done, and we've
Yeah.
moved on, and we use alternatives. But I think it's worth noting because this was not a science-based decision. It was
Yeah.
purely a marketing, a marketing and a decision based on misinformation and fear. So the story that most people don't know is that parabens have been used as preservatives in cosmetics since the 1920s. They were always safe, effective, inexpensive. They were endorsed by global health authorities. And I did a really, really deep dive into parabens, and went down hours of a rabbit hole with this because I really wanted to dig into what happened here. Because from what I understood, the concentrations at 0.01 to 0.03% were far below any threshold of concern. But in
Mhm.
2004, Dr. Philippa Dobre detected trace amounts of parabens in breast tissue. That's did not so she found the parabens in the breast tissue, right? That's all she did, right? She did not establish causation, which is important. There was no control group. She did not, she didn't compare it to other cancerous tissue, like compare the cancerous tissue with the healthy tissue. There was none of that. She wasn't doing a paraben study per se. And the author herself called it preliminary and explicitly requested larger follow-up research, right? She later publicly clarified that her research did not conclude that parabens caused cancer. The problem was is that by the time this came out, the study went viral, right? None of what she said mattered. And it's not that it went viral through the scientific channels, which is what I found interesting. It didn't. It went viral through the media, through advocacy groups, and eventually through marketing departments until paraben free became a virtue signal. And brands started reformulating, removing their parabens. I can't speak. And because consumers became frightened in believing that this preservative system, which had a century of safe use behind it, was causing them harm. Um, the problem is that replacing the parabens, it's been a while since then, so we've come a long way, but replacing the parabens wasn't as simple as people thought it would be. The alternatives were less stable, less effective, more sensitizing, and often required much, much higher use concentrations. And what consumers then thought, they were being protected by being paraben free now meant that, they were using products that might have had an inferior or less safe, preservative system in their absence. Anyway, that ship sailed, like I said, we're not gonna, I just wanted to bring this story to the audience so that you guys understand the difference between actual free from, in the case of toxicology and, and things that were just grounded in fear. So Mark, let's talk about the new clean beauty movement, because it's very different than what you described in the beginning. So from
Yeah.
your seat, okay, what has the clean movement, this new version of the clean movement, gotten wrong about preservatives specifically? And what has it actually cost us?
Well, as you said, parabens have been around and used for, 100 years. So going to that study, it's not surprising that she found some trace amounts of parabens in tissue because everyone's been exposed to them. But, the advantage of parabens is one, just the very, very long use pattern and history without any adverse events. And two, they can be used at very low concentrations relative to other preservatives. So by moving away from parabens, you're right, you have to look for preservation alternatives that have to be used generally at higher percentages may induce some skin sensitivity, allergic reactions, irritancy, etc. So what they've gotten wrong is basically taking a perfectly fine ingredient that has been very, very well studied and documented, and regulatory authorities around the globe, recognize parabens as as an effective preservation ingredient, and completely demonized it so that now you really, if you want to formulate a product with parabens, a new product going into the market, good luck, right? Uh, so, so that's what they've gotten wrong is basically once that misinformation got out there, there are two culprits here, I guess. One are the people who propagated and misinterpreted the study, then propagated that information and it spread over the internet. And two, the manufacturers of parabens who didn't do very much, honestly, to defend their ingredient and to conduct those additional studies, right? To prove that, yeah, there's nothing to worry about here. And it puzzles me to this day. If I were an ingredient manufacturer and my ingredient was under duress due to misinformation being spread over the internet, I would conduct the studies to protect my market and to clarify the safety of my ingredient, but they just really didn't do that. It's very
Mhm.
strange
Yeah,
reaction.
no, absolutely, absolutely. And like I said, there's no coming back now. I
No,
mean,
no, there's
that
not.
ship sailed.
Yeah, that's done.
Yeah, that ship sailed. And maybe I'm the only one advocating for parabens.
Uh,
Maybe I
well,
should stop, Mark. Stop,
they're
just stop
still,
me.
yeah, they're still widely used in a lot of legacy products, but I have not seen a new product introduction that contains parabens in years. I mean, this
No.
is now 20 years plus where this controversy came about. So, it's basically a disservice to everyone.
Yeah.
And you would, like you said, it's not even worth conducting the studies right now to address the issues.
No, no, no. And I think, formulators have gotten used to formulating with alternatives,
Without,
and
yeah,
it's
yeah.
just this is the new normal. So let's just talk a little bit about free from again.
Mhm.
So, bringing in the difference between free from as a virtue signal versus free from as an actual, as good formula architecture, from a toxicology standpoint. Can you explain to the audience, what is the difference between a brand that just removes an ingredient because of the marketing and one that actually formulates just does a thoughtful formulation,
Mhm.
and removes particular ingredients because it doesn't fit the architecture of that formula?
Well, that's those are two completely different decision points, right? So if you have a brand that is focusing on free from, and I run into this all the time.
Hmm.
The issue in addressing that, first of all, in technically in Europe, you cannot advertise free from, although it's very commonly done. But I honestly think that at this point in time, consumers are kind of numb to the free from claims because it's the same across the board. Just very broad, very general free from claims. Um, the issue that I personally have with that is unless a cosmetic ingredient is prohibited from being used in a product, or there are use restrictions, the percent that you can use, then every ingredient's fair game. And in formulating, as you said, for architecture, you're going to use and be very discerning about the ingredients you use, and you're going to pick the right ingredient for the job. Uh, so it's better, in my opinion, to just kind of ignore the free from claims, formulate the best product you can, and if you happen to be Credo Clean compliant, based on that, great. Or Sephora or any of the clean beauty standards, great. If you're not, then I would not worry about it if I were a brand. I'd focus on the performance of the product.
Mm,
Because I also don't think consumers are largely driven by the clean seals of the various retailers on the brand. So that's all kind of 5 years ago, line of thinking. Um,
yeah.
yeah, so I don't think any of that really resonates that much with consumers anymore.
Mm, mm. And you know, it's true though. I think we spoke about this when you and I spoke the last time. And I said to you, I really do feel like it's behind us.
Yeah,
That whole movement, and even Credo Clean, Spore Clean, Target Clean. Oh my God, the list goes on. You know
yeah.
what I mean? They really. I don't think consumers care anymore. Do you know
Uh,
what I mean? I don't think
yeah,
it's number one on their list. And of course, Mark, don't get me wrong, there will always be a consumer for that,
yeah,
right? There will
yeah.
always be that consumer. But I think that, the direction I see the market heading is more in, the idea that if a formula is if the architecture is solid and the formula is well thought out, and well done, it'll always be clean and safe. And wasn't that the
Yeah,
point?
yeah, that's the whole point. That's the
Yeah.
whole point. You don't have to conform to a list, because consumers probably don't know what's on the list to begin with. They're just looking for well-formulated, safe products that are effective and have good performance. You
Mm,
know,
mm,
the whole clean, free from uh, era has completely now evolved into performance.
mm. No, absolutely, absolutely. I mean, we've come so far that you're even hearing consumers talking about delivery systems, and,
Yes.
and
Yeah.
that was a stunner for me. I was like, wow, okay. You know what I mean?
Yeah.
So we've even started moving away from the whole hero ingredient conversation. So,
Yes.
and it's a good thing. I think it's a good thing, and I also think this is something that really did come from COVID, when people had a lot of time on their hands and they really wanted to
And
understand and know.
and
So,
the research. Yeah.
absolutely. But again, this brings me back to the point I come to at every time, in every conversation that I have, when it comes to formulation, you know, founders, investors. I can't stress this enough. Your number one criterion for deciding on who your first partner will be is choosing the right chemist. And that's it. Because when you have the right chemist, when you have the right formulator, you're going to, all of this will just become easier, because
Hmm.
you have the right person in front of you. And okay, so I think that we've talked about this as well in the past, but I just want to touch on it again here, because I want to talk about R&D decision making and choosing partners. So some founders will choose a lab separate from their manufacturer, and others will just go directly to the manufacturer for everything, including the R&D. And that's fine, right? But how do they know, Mark, when they're just getting a chemist say yes to them, right? Because you know they're not formulators, they're not chemists themselves,
Hmm.
right? They're going to the expert to get what they're looking for. They may come with an idea, a concept, they may even come with a brief,
Hmm.
right?
Yeah. Yeah.
Um, but sometimes, especially when the reason for saying yes is because we want your manufacturing business. So we want to get you in and out of the lab as fast as possible, because where we make our money is on the floor, right? So for me, it's like, how do you know when you're standing in front of the right chemist?
Oh, well, I'll put that in the context of preservation. So if you come to me, for instance, and you tell me you want a self-preserving formula or a preservative-free formula, the first thing I'll tell you is that's not a risk worth taking. There is no such thing. And try and drive the client to the understanding that you have to have preservatives. That's just too big of a market risk in terms of reputation and financial and consumer health and safety to pursue that path. Um, so if you don't get pushback from your chemist, then you're not getting good advice, is the way I'd put it. So a lot of clients will come with a brief, and they'll have and some ideas, some things sketched out. So what you're looking for is a chemist that is going to understand, first of all, what are you trying to develop in terms of a product? What problem are you trying to solve? And while you may have some ideas, uh, your chemist is going to better know what ingredients to bring to the table and format and delivery systems and preservation and everything else. So you're talking to the wrong person when they just take your brief and there's no pushback on anything or no new ideas being brought to the table to really develop
Or
a
at least
superior
just a
product.
discussion. Yeah.
Yeah, yeah, yeah.
Yeah.
Now, ultimately, if you don't, as a brand developer, if you don't get pushback from your chemist, you should be quite skeptical. Would be my advice.
One would think. One
Yes,
would think.
you would hope. You would hope.
Right, right. Okay, so then let's carry on then with this thought, right? So you're standing in front of your chemist, right, as the founder.
Mhm.
You've given them your brief, and now let's just talk about preservatives specifically, because that's what,
Yeah. Yes.
preservatives and preservative systems is why we're having this conversation. What are the 3 or 4 questions that they should be asking the chemist about preservatives specifically?
Uh, what is your experience base with the preservation system you're recommending, right? Why do you not use alternative preservation systems? You know, or I'll call them non-preservative preservatives. So, for instance, you have a list in the EU, you have a list of approved preservatives with the, use percentages that can be used in cosmetic products. You don't have that in the United States. A lot of clients are very preservative sensitive, I'd say. And, I always counsel them, and they kind of ask that question, particularly if they want to use alternative preservatives. Uh, what is your success rate with these alternative preservatives? And to be perfectly honest, the failure rate's about 50%. That's why, yeah, they don't work. You know, you can
Yeah,
put
that's that's
together
that's scary.
yeah, you can put together the whole hurdle technology, components of your preservation system, but a lot of these alternative preservatives do not work. They might look good on a label, but you're just asking for trouble. So the first thing I would ask is, okay, here's what I'd like in terms of preservation for my product. You as the chemist, what are you recommending to me and why? And that opens up a discussion so that they can come to understand that they're taking a risk that they don't need to take by not using proper preservation in their products.
Mm, No, absolutely. That makes perfect sense. And I mean, it'll also probably, which is the harder one, prompt them to know when to walk away. I'm just saying, no, thank you.
Yeah,
You know what I mean?
yeah,
Rather, like I'm always saying to people, rather walk away at that stage than get all
yeah,
the way,
yeah,
you know?
yeah. And you can provide your best advice, but some people are insistent on pursuing their idea. So to be honest, you just let the preservation challenge test prove what you were telling them to begin with.
Okay.
Wasted time,
So
wasted money.
yeah, 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 yeah.
Yeah.
Listen, so much has to be taken into account at the R&D stage, at the R&D level. You know what I mean? Like, and even back to packaging. That is a conversation that needs to have at the R&D level, not at the end.
Yes.
When you're trying to think of, oh, what pretty packaging can we put this in? You know what I'm saying? With the baby wipes, the substrate, the cotton, you know what I mean? That
Hmm.
brings me down to supply chain. Where's this coming from? Who's the manufacturer? Where are they getting the cotton? How is it warehoused? Where is it being stored? Did you
Yeah.
test it? Did you
Or are they
test it
testing
before
it?
it came to the facility? Sorry.
Yeah. Or are they testing it? Or is the contract manufacturer lot testing the substrate to make sure it's clean, right?
Yeah,
Or to determine how clean is it. So
yeah,
there's a lot of failure points along the chain.
yeah, yeah. Look, I mean, it just like I said in the very beginning, the reason why I used that specifically as an example is because, like you say, there are so many failure points along the way. And it seemed like, for this particular brand, there was just, you know, one fail after another, after
Yeah.
another. And at what point could somebody have just stopped them and said, hang on, whoa, you know what I
Yeah.
mean? Like,
Yeah.
did somebody notice something along the way? I mean, I don't know.
Well, that's the problem with preservation is there's no eyeballing it. Unless it's mold, you're not gonna see anything. And a lot of consumers think, unfortunately, that if you can't see anything, then it's clean. But no, it can be really heavily contaminated, just not with visible mold growing on it.
Mm.
So that is, you may have some malodor depending upon the degree of contamination, but those are really, as a consumer, those are your only signals that your product is contaminated.
I know, and usually, I mean, Mark, usually by the time you can see it or smell it, it's
It,
way far gone.
it's way far gone. Yes, yes,
And particularly if it's a product that's being used and marketed for the most vulnerable,
yes.
whether it's the elderly or newborns.
Mhm.
I don't know. That's just it's just terrifying. You know what I mean? All the things that can possibly go wrong. But that's why we're having this conversation.
Yeah,
To hopefully, to prevent this from happening to someone else.
yeah.
So as far as founders go, across everything that we've covered today, right? Preservation as architecture, the clean movement damage, the chemist relationship. What's the single thing you'd want every brand founder watching this to take away today?
Select your chemist carefully. Make sure that you're using proper preservation for your products. And that's not something you want to play around with because the consequences could basically lead to you losing your business if you have reputational damage and you've got an FDA recall. You could lose your business over it. So it's not a trivial consideration or a trivial decision. It's probably one of the most important because the consequences can be pretty devastating for a brand.
Absolutely. And from an investor's standpoint, because, sometimes everything rides on an investor's final decision. When they're in the diligence phase, right, and they're looking at a brand, just from a preservative system standpoint, because they're not chemists. I don't think most investors even read an INCI list, or even know how to or understand, the names they see there. But are there maybe diligence questions that they should ask?
Oh, sure. If they're looking at it, I mean, they would want to see the safety substantiation dossier on the product. The preservative challenge test results are a component of the safety substantiation dossier. The HRIPT studies are a component of it, and the cosmetic product safety report is a component of it. So they should ask for all of that documentation to make sure everything is in order and that the product going out the door is safe for human use.
Mm, mm. No, listen, to what you just said, I can't stress enough, and I think I cover it so much. You investors, you need to ask to see the safety dossier.
Yeah.
You know what I mean? You can't just take, ask, do you have one? And the answer is yes. Okay. No, you need to see it, you need to look at it, and have somebody else look at it.
Hmm.
If you don't know what you understand what you're looking at, find someone who does. There's so many people out there who do this for a living, you
Yeah, and
know.
these documents are all validated by third parties. The tests are conducted by third parties, so it's not something the brand is in control of.
Mm,
So, if you have diligence questions, call the lab. Call the lab that did the preservative challenge test. Just validate it, confirm it, even though you have the paper in front
mm,
of you.
mm. Yeah,
Call whoever did the HRIP testing. That's all part of good due diligence,
yeah,
is
yeah.
covering all of your bases.
And again, talking of testing, like I'm always saying, ask for the reports, ask to see the data on the actual packaging that came in, on the actual, the substrate. Who tested
Hmm.
it? Was it tested?
Yeah,
Get the supplier information, find out who that supplier is. There should be a full paper trail that you can f
yeah.
follow, of that supplier.
Yeah,
Um,
to the
Go
extent
ahead.
that there's a contract manufacturer, they can talk to the contract manufacturer to understand their quality QA, QC. What testing do they do on the product? What testing do they do on the incoming substrate, for instance? They're technically supposed to validate each and every ingredient going into the product from the suppliers. But in this case, maybe they weren't testing the substrate and they were
Yeah,
getting contaminated, putting juice on a contaminated substrate, and there's your failure.
yeah, yeah. Like I said, I mean, the failure points. If we try to break down all the things that could have happened along the way, I think Mark would probably be here for a good few hours,
Hmm.
because there's so many things that could have gone wrong with that.
Yeah.
But the final question that I ask everyone is, if a founder, and talking about preservative systems specifically, Mark, is there something a founder can do this week, not this quarter, not this year, but this week, looking at their own formulation files, to know whether they're on solid ground?
Yeah, they can retest their products, for instance. I mean, you technically only need to conduct a preservative challenge test once, and that's before the product ever goes to the market. But it's maybe a good idea to, as you're in manufacturing, cull some samples from the manufacturing line. Your microbial QA QC is typically done on the batch, but as you mentioned earlier, every batch is going to be clean. So, you're not going to have very much in a freshly run batch. But periodically, it's probably a good idea to pull samples from the manufacturing lots and redo your preservative challenge testing. Just make sure everything's above board.
Mhm. Well, Mark, that's it. We managed to get through
Okay,
this.
good, good.
I know there was a lot today. I know we spoke about a lot today. And for the audience, this brings us to the close of our interview. But in closing, here's what I want everyone watching and listening to take from this. Preservation is not a list of ingredients. It's a system. And it's designed against specific risks in the context of a specific product. and validated by rigorous testing. A formula that has preservatives is not the same as a formula that is preserved. The wet wipe case, the one that we've been speaking about in this episode, infant targeted, market pulled, just the fact that it was market pulled is proof that preservative systems, can be your failure point.
Hmm.
And, the people who design that system, your chemist, your R&D team, your formulator, these people are the highest leverage hires you're going to make. And they're the ones that you need to build your brand. So choose someone who will tell you not what you want to hear, but what you need to hear. Don't choose the person who's just going to say yes to everything just because they want to win a contract. Find the person who's going to push back, find the person who's going to ask you questions. And if you need to say no and you need to walk away, then so be it. Rather do it then than do it later. And the distinction will determine whether your product holds up and your brand's reputation holds up and if
Yeah.
the consumers are safe. So, Mark, this was the third time that we've had
Yes.
a conversation together on Pretty Equity. And every time the conversation, like I said earlier, just keeps getting sharper. So thank you for being so direct about what's actually happening in formulation, what the clean movement has become and what it has cost us, the whole free from conversation that we had and the things that founders and investors need to know about choosing the right people. To everyone watching and listening, if you found this conversation valuable and if it changed how you think about a category that is as consequential as preservation, please share it, like it, and subscribe on YouTube and Spotify. And the interview series is also now available on Substack if you want to read this one or any of the past. It's there in written form. And of course, follow me and Mark on LinkedIn for more of the issues that drive smarter beauty investment. I'm Mallory Johnson. Thanks for watching and listening, and I will see you all next time.